because sometimes there are marriages within the family in the sense ki they say ki mama ki ladki, there could be first
distant relatives or in the same community, clan basically.
Exactly.
Right.
So at that time, genetic counseling does become important. Because if there is a family history of any genetic abnormality, then the counseling needs to be done. The testing of the couple needs to be done. Forget about all that. Chalo, wo ek part hai. Thalassemia.
Right.
Thalassemia is such a major problem for the parents whose kid suffers from thalassemia major. But what happens is अगर वो parents ने just अपना testing किया होता, see अगर दो parents thalassemia minor है, तो there's a 50% risk of the baby having thalassemia major. Now we actually had a couple who was thalassemia minor both. So what we did was हम लोग ने उनका IVF किया. उनका जो embryo है, before putting it in, we tested that embryo for thalassemia major. So they actually gave us 6 embryos. हमने 6 एम्ब्रियोज को टेस्ट किया, 3 में थैलेसीमिया मेजर आया, 1 में थैलेसीमिया माइनर आया और 1 नॉर्मल आया.
So that normal was
so you can do the normal and thalassemia minor का ट्रांसफर, because thalassemia minor hemoglobin low रहता है, पर you can lead a full life without compromising quality. So we put in the normal one first. Luckily that stuck. They have a normal baby without any thalassemia, and we tested it in pregnancy to confirm it. जो amniocentesis बोलते भी हमने किया, and it turned out to be fine. And the couple was so happy that the child did not have to suffer. So again, awareness about this is probably not there, that you can avoid this. But there are so many couples who have a child who has thalassemia major. But they might be unaware that they are thalassemia minor. So I always say कि कुंडली मैच करने के जगह पहले genetics मैच करो, उसके बाद देख लेना.
That means it is so important to see the family history and the genetic considerations for a couple who's planning a pregnancy. I hope everybody out there is making a note of this, because honestly, ये एक बात है जो अब नई तरीके से doctors are basically looking into it, giving a lot of importance to it. And आज के podcast के बाद realize होता है why it is so important.
Absolutely.
Seriously, right? So basically, एक बात बताइए आप, जैसे for example, like you said, a father, a male who has become a father at a later age can have a possibility of an autistic child, right? Now, अगर suppose एक बच्चे में autism है, एक sibling में, now these siblings have grown up, right? So दूसरा sibling normal है, तो उसको अगर जब उसका time आता है conception का, they should consider the family history.
So autism is not generally genetic. It's more age related. It's that studies talked about age. So with autism, it's not so much ki if there's autism, there's going to be autism in the next generation.
No, but considering कि अगर family में कोई ऐसी चीजें हैं, तो उन couple के लिए it is better कि genetic consideration counseling
always consider genetic counseling. Right. Maybe not with autism, but any other disease like deafness.
बिल्कुल.
If there's deafness, or someone loses their vision at an early age, or babies born with spectacles. Now, there is a condition जहाँ पे congenital myopia बोलते हैं. हम लोग बोलते हैं ना दूर का चश्मा देखने के लिए. They are born with that condition when they पैदा ही वैसे होते हैं कि उनको चश्मा पहले से ही लगता है. So these are patients who could possibly consider genetic counseling in the future. Because the last thing you want is having your child wearing specs and going through that trouble.